Hello everyone, welcome to my channel. Let's talk about cancer. In this video, let's talk about tongue cancer. Tongue cancer is relatively common in India in both men and women, more among men. This is primarily related to our habit of smoking. World over, smoking has been proven to cause tongue cancer. In India, there is the added burden of consumption of oral tobacco, which also contributes and has a high risk of tongue cancer. Now, tongue cancer can occur on the side, on the top, below the tongue called as floor of mouth, or back of the tongue called as posterior tongue or oropharyngeal tongue. Now, the treatment of tongue cancer is involved in two parts. If it is the tongue which we can see, also called as the anterior tongue, then usually surgery is the first line of treatment, followed by some form of radiation or chemotherapy based upon the stage. If it comes on the back part of the tongue or the posterior tongue as we call it, then usually it is associated along with a viral infection called HPV, and the treatment is usually a chemotherapy or radiation combined to avoid the problem of removal of this part of tongue, which will make swallowing and speech almost impossible. And the outcomes with radiation of the back part of the tongue are also quite good. When we are talking about tongue cancers, we usually talk about the cancers of the front part or the anterior part of the tongue. Now, the treatment depends upon the size of the tumor. If the tumor is small and we can get away with removing only less than 1/3 of the tongue, usually we don't need to reconstruct this. Whereas if it's involving more than that and we need to cut it with a margin, which means we'll have to cut about half or more of the tongue, then if we do not reconstruct with a good flap, then neither speech nor swallowing will be possible, and we'll have to do that accordingly. Today a lot of good flaps are there, which at the end of surgery creates almost a near normal tongue and helps in speech and swallowing as well. So whenever we are treating tongue cancer, we always have to address the neck also. We have to open the neck and clear all the nodes to which the cancer has gone or is likely to have gone, and that completes the surgical treatment for tongue cancer. This will be usually followed by radiation with or without chemotherapy. So this is the treatment that we have for tongue cancer. But if we can avoid smoking and prevent this cancer from occurring, or if there is a non-healing wound on the tongue for more than a week or two, to get a biopsy done and to check it if it's cancer, so that we pick it up in the early stage, then the chance of cure is very high. Good day.